Good afternoon, everybody. It's lovely to be with you here today. We've got quite a significant number of people. I've had a bit of a look at the list here today and such a beautiful cross-section of my colleagues, friends across three sectors. I'd like to begin by acknowledging the traditional owners of the land. I'm here on Wurundjeri land of the Kulin Nation. I'd like to acknowledge elders past and present, elders from other cultures, and that this is and always will be Aboriginal land. Today's webinar is part of the Tripeak series. For many of you, just to reflect, Tripeaks is this magical piece of infrastructure and a collaboration between the Centre for Excellence in Child and Family Welfare, the Victorian Healthcare Association, and the Victorian Alcohol and Drug Association to support integrated policy, practice, good governance across our three sectors. And frankly, I'm not sure what we would have done without it during COVID. It's been just a wonderful, wonderful thing to have in place. I'd like to acknowledge Tom and Sam, my colleague Peak CEOs. I know Sam's here today, but I want to say how fantastic it is to work with you across three enormous sectors to get the sorts of outcomes that we're getting. So just to let you know again, and I know that you know this housekeeping, but it's always important to remind you, this is a Zoom webinar. So please use the chat and Q&A functions for your questions or comments. We love comments just as well as questions. And at the end, if we have time, we'll also have a Q&A with Sonya. In today's webinar, we will explore global trends in long-term COVID resilience, examining what is being done around the world collectively, individually, and organisationally to survive but also thrive through the extended impacts of this pandemic. Looking into what we can expect over the next few years, this critical webinar will delve into the initiatives, ideas and infrastructure that are being implemented to maintain and support resilience across the world. So now I'm delighted to start by introducing Sandy Pitcher. Many of you would know her by now. She's been out and about for a few months talking to many of you. Sandy commenced as the Secretary of the Department of Families, Fairness and Housing in February 2021 after being appointed by the Secretary-Designate in December 2020. Many of you would not know this, but in July 2020, Sandy was seconded to the public health effort in response to COVID-19 and was leading the case management, contract tracing and outbreak management effort. Now I stop here to say, look at how magnificent Victoria is going in our COVID effort. And I have a strong suspicion that Sandy Pitcher set us up for success in what we now see as the system that's in place, with Sandy shaking her head. But, you know, all of these efforts have contributed to having a really great system here in Victoria that we all feel pretty secure with. So thank you, Sandy. Before this role, Sandy was the Deputy Secretary Higher Education Skills in the Department of Education and Training from October 2019. As Deputy Secretary, Sandy was responsible for supporting the delivery of operational and strategic priorities across higher education, vocational education and training, apprenticeships and traineeships, and adult community and further education. Sandy has also served as the Chief Executive Officer of the Department of Environment, Water and National Resources in South Australia for 3 years, and as the Deputy Chief Executive at the Department of Premier and Cabinet in South Australia for 5 years. But this is something I didn't know about Sandy that again is really interesting. Her international government experience includes executive roles in the United Kingdom's Commission for Race Equality. She's also held a variety of senior positions in the Australian Public Service. We're really, really lucky to have Sandy here today to make some opening remarks about the environment we're in and to get us started. Thank you, Sandy.
Thanks so much, Deb, and hello to everyone. And Sonia, very much looking forward to hearing from you and the other panelists today. So, Deb, a super kind introduction, and I'll just follow your lead by acknowledging the land that we're all meeting on today and paying my respects to elders past and present. I spoke to Deb about this session and said how keen I was to actually attend, and she said, no, I want you to open it. And I said, no, I want to hear. I want to hear from others. And so I will certainly not spend too long talking so that we can actually hear from others. But I did want to take a chance to reflect quickly on my time working directly in COVID last year. more on the point of being able to assure all Victorians about how proud and impressed I am with the team we have working now. Like, we really should all feel very secure in the work they're doing. And possibly that you, like me, now feel like you can be an armchair expert and say that absolutely the fact that nearly all cases were isolating the entire time that they might have been infectious means a very great deal, and we should feel some comfort on that. But it goes to a greater point, I think, that are some of the COVID lessons, if you like, for now and going forward that I reflect on. So I think for me, there's something about what we all learnt by being part of something, no matter where we were working and what we were doing. COVID consumed all of us last year and continues to consume many of us this year in different ways. That meant we really were, especially with all the jobs that we're holding, working on something together in a way that we hadn't sort of seen our job framed before. And the way that I think brought, I hope, and I think I saw it, greater understanding across the challenges for all of us in the various work we do and the way we do it. So I think there's something there about having that attention and seeing what we can all do when we focus our energy together and we really feel that empathy of what's happening for so many of us. The other part, which I guess is a little bit of a personal reflection, but certainly goes to your point, Deb, is that, you know, I had never worked in health, and certainly the closest I'd done is working in social determinants of health and speaking about that work and the way it intersects with other policy areas. And so to suddenly find myself as Deputy Secretary in the Department of Health was a very, you know, as if the times were not strange enough, I thought. This was even stranger. The thing that I learned and carry with me now is that when you're dealing with any kind of complexity, the skill sets you need are never just singular. The ability to bring lots of people together with different expertise, but also the importance of generalist skills and people who can have different perspectives on a problem are things that we've all seen studies on, but actually to live it and see it happen and to see things change in the way we were setting up our operations, I thought was just something that I consider a real personal experience of my life that I probably would have never wished on anyone, but having experienced it, it will be a lifelong lesson for me. And I really hope that we can take some of those crisis lessons into our working lives. So what is it about bringing different ideas, different concepts, asking different questions that we don't do in day to day, and how do we bring that discipline and opportunity into making our work better? Because the questions we're answering, whether it be kids in care or looking at the rates of child protection or looking at the rates of Aboriginal young people in our government systems across justice and residential care, for example, these are problems as big as COVID and as stark to deal with, and they're happening over a longer period of time rather than a short time. That doesn't make them less serious, perhaps makes them all the more serious. So I think that the panel will have a lot of lessons for us, and I think if we carry that kind of question with us, that will really bring the strength to this conversation and the conversations to follow. So thanks for having me, Deb, and I really look forward to hearing from the team.
Thank you so much, Sandy. That's to get us going. And I know you did this at really short notice and you were really interested. So that always sort of is really exciting. And you're absolutely right. There's just so much to learn. So I'm going to move us forward by just talking about some of the things when we were reflecting on today, some of the things that we're pretty proud of. Because actually, I think you're right, Sandy, pride, we all can get a bit gloomy and we can all get a bit stuck, but we should also be really proud. And I suppose from our perspective, the fact that reform hasn't stopped in the child, youth and family services sector during a pandemic. Sonya did work on the design of the FPR. The sector are now implementing and it's broadening it across at least 100 organisations is phenomenal, given that ordinarily we'd be saying, well, let's put up stops. We can't do that now. That's just not been the attitude. So that's pretty exciting from our sector's perspective. From the perspective of my colleague, Tom Simonson from the Victorian Health Association, he's commented on the remarkable work between acute health and community health during this pandemic as being something that hasn't been seen before. And and Sam commented on the additional 100 alcohol and drug clinicians as a result of the Mental Health Royal Commission. These are sort of astonishing things that the magnitude shouldn't pass us by. And today is about talking about some of the sort of mini miracles that have actually occurred during COVID. So now I get to introduce Sonya. Sonya's a partner in People Advisory Services at EY. You may remember her. I'm sure those of you who are here today, because there's a lot of loyal people out there who come to these webinars because they're so goddamn good. You may remember Sonya from last year's webinars on tools for working remotely and privacy implications and global workforce perspectives and practical strategies in COVID-19. I have to say, Sonya was the first person to call to say, how can I help? Now, again, just wonderful stuff. How can I help, Deb? And, you know, Sonya does this for us and for you out there. So I just want to commend her for that, because the how can I help mantra is alive and well and is cross-sectorial, isn't just in our sectors. So I want to call her out for her wonderful collegiality towards the work we do. Sonya has dedicated over 30 years to public service, with 17 years as a senior executive in the UK, leading education and child and family services, and most recently as Deputy Secretary in the Victorian Government. Sonya is a partner in EY's Workforce Advisory Practice, as well as a national lead on public service workforce and the COVID-19 response and recovery. Sonya provides bespoke advice to state and territory governments across Australia. She brings extensive experience in emergency planning and response, and has conducted post-implementation reviews to assist organisations in understanding how well they've managed in their crisis response, as well as how they can improve future practice. She's got a wealth of experience in strategy development, performance improvement, organisational design and complex system change. Welcome, Sonya. It's going to be a real treat to hear what you put together for us from a global perspective. I'll now hand over to you.
Thanks, Deb, and thanks so much for that lovely start. And Sandy, fantastic introduction. So really pleased that you're able to join us as well. And hello to all of our stalwart friends and colleagues from across the sector. Before I start, I also would like to acknowledge the traditional owners and custodians of the lands that we're each taking part from today. I'm joining you from the land of the Wurundjeri people, and I would like to pay my respects to elders past and present and emerging community leaders. I'd also like to acknowledge the important role of Aboriginal and Torres Strait Islander people within the children and family services sector. Your work is extraordinary and important. And I also would like to be really clear that this is the land of Aboriginal and Torres Strait Islander people as the first people. And I'd also like to remind you as we go through, please use the chat function to make comments, observations, share your own experiences. So what are we going to do? So I'm going to take you for a quick canter through taking a moment to celebrate what we've achieved so far, and Deb started that, so thank you. We're going to have a look at what's happening around the world. We're going to think about how we can build collective and individual resilience as we manage the continuation of the pandemic and the ebb and flow of we're in, we're out, etc. And most importantly, let's look forward with optimism. That is my big takeaway message. It's easy for us to be gloomy, but in actual fact, we have got so much to be hopeful about. And as both Sandy and Deb helped us to understand and reminded us of, this is a story of human flexibility, innovation and resilience. You know, if you think about the experience of the pandemic, it's challenging for everybody. So, you know, today's figures, 192 million cases of COVID around the world there've been so far, with just over 4 million deaths. 65,000 new cases a day. And if we think about the Victorian experience, you know, this is our third lockdown in 2021. We spent 50% of our time in 2020 in living and working remotely, unless we're in essential services, and that's set to continue. But if we think about what we did there, so first of all, go back to last March. In 10 days, 90% of organisations across Australia and throughout Victoria transferred their ways of working to some or partly, all or partly remote in 10 days. And we've been able to just pivot backwards and forwards since then. It's easy sometimes, I think, when we hear that lockdown announcement to feel a bit gloomy, but can I tell you that all of the research shows that it's one of the most effective strategies for us to maintain safety and manage public health well. So we should be grateful that we and feel fortunate that we're living in a context here in Victoria where public safety and public health is paramount. And although it's tough, it's what we have to do. At the moment, around the world, 436 million organisations and enterprises are experiencing significant disruption, just like we do. They've had to just change the way they're working in order to do it. So we're not alone. And when we talked last year, and some of you were here when we ran those first webinars last year, and we were talking about this is not a sprint, it's a marathon. Well, now we know it's an ultra marathon, and we know that it's going to continue for this experience is going to continue for some time, probably for 3 to 4 years. Globally, 13% of the population have had their single vaccination, 26% have had their single vaccination, 13% have been double vaccinated. Until globally, 70% roughly of the population, of the global population, have some kind of immunity, then we're going to continue to experience this virus rolling around, and it's with us forever. It's like the common cold now. Or the flu strain that we get every year. And so hopefully vaccinations will be vaccinated relatively soon, and that will enable us to be mobile, but we'll still get COVID-19, and we're seeing that in the UK and the US at the moment. So UK with its Freedom Day, you know, huge number of cases every day, and about 20% of the workforce is affected because people are sick, but they're not dying, and that's great. So we need to think about this as a long-term gig, and we need to, and therefore our resilience is crucial. And what we're seeing around the world is we're seeing some really innovative ways in the ways that people are responding to this. And there are two key themes to what we're seeing. So if we can stick with that one, thanks. There are two really big themes that are emerging. That one is a trend towards volunteering. And we're seeing some extraordinary examples of voluntary practice. I'll give you some examples in a minute, as well as the really creative use of digital solutions to helping us work in a remote way, but also work differently when we do come back into the workplace. This theme of connectivity, which interestingly we heard from Sandy at the beginning, we heard from Deb in her examples, is really, really important. So say, for example, some examples that we're seeing around the world. So some of you may have heard of Earth School. So this is with TEDx and the UN have developed this Earth School, where and it's an interactive school program that helps children and young people and their parents reconnect with nature, where they young people and their parents are encouraged to go on 30 adventures into nature around the world. In Montenegro, they've launched a one-tap alert for victims of domestic violence on a phone. UNICEF have come together with a whole range of international NGOs to make sure that 12.8 million of the most vulnerable children in Uganda have access to healthcare and basic education during the pandemic. UN volunteers. In Peru, there are 20,000 digital volunteers who check in with 400,000 old people every day just to make sure they're okay, that they're to socially interact, to check in with them in case they're ill, etc. So, and we're seeing the kind of volunteerism spreading through communities, young people volunteering. In the UK, 30,000 volunteers getting prescriptions, just checking in, doorstep connectivity, building community, building a sense of community. And here in Victoria, we've seen some tremendous examples. And I remember last year on one of our sessions when we had that brilliant session with Muriel Bamblett talking about community building within our Aboriginal and Torres Strait Islander communities, and how that has just strengthened and been a real mechanism for connectivity and community. In the Ivory Coast, Côte d'Ivoire, they've developed a nano server that enables midwives to access learning materials and training materials connect around delivery of children in during COVID-19 safely, that doesn't need any connectivity whatsoever, and they can use it anywhere without internet access. And in Rwanda, there are 5 anti-epidemic robots that are helping to fight COVID-19 and detect cases and help frontline workers fight the pandemic. And they're going around like we see now those robots in supermarkets who tell you whether the shelves are empty or not. I bumped into one of those in Coles the other week. But these robots are detecting COVID out and about, and there's just all sorts of different ways in which people are saying, okay, they're just facing into this and doing extraordinary things that they might not have done before, and we're doing the same. And this kind of connectivity is really important, human connectivity. And those are some examples of kind of the voluntary digital type thing that's happening. But also there's all sorts of simple things. And I'm just going to remind us of those kind of 2 singing examples. I love singing. But in Italy, we saw that tremendous vocal coming together when people were on their balconies every day singing together and coming together in music. And in the UK, there's the UK National Choir has developed, starting online, where thousands of people came together every day to sing together. And we've got lots of examples of that. I think there's the Royal Children's Hospital and the Victorian hospitals have come together and done a choir. So there's lots of examples of us finding each other and coming together. And I'm hoping that going forward that we won't ever lose that connectivity, that we'll continue to develop it further. What we're seeing in organisations around the world is that the importance of building resilience in our workforces, and also I would say ourselves. And what we've seen is some common features of organisations and communities that are really resilient. And we're calling this the resilient quotient, the new Q, the RQ. And it consists of 3 key components. First of all, digital maturity. What we've learned over the last 18 months is extraordinary in the development of our digital maturity. If I speak for myself, I can do things now that I never could have done before. I'm very proud of myself in my digital maturity, and I'm sure you all are too. So organisations that are resilient will continue to invest in their digital maturity, and as we return to work, we will keep some of those skills and we'll continue to develop those, and most of us will be much more open to digital opportunities than perhaps we were before. We also know that the most resilient organisations are those that invest in people. They have a really strong EQ and CQ. So they are deeply interested in their employee experience. And what we're seeing now with return to work is people thinking carefully about how we bring people back into the workplace in a way and at a pace that will work for them. And what we've seen globally, and we've just done a massive survey of now 20,000 people around the world, and what we're seeing is it doesn't matter what sector you work in, it doesn't matter what country you're living in, people are saying that well-being and safety is paramount, and flexibility is the second big employee value proposition going forward. We've all changed the way we think about the way we do things. So if we can move on to the next slide, thanks. Yes, thank you. No, cultural agility, cultural quotient, if you can go back to that one, please. Thank you. So just going back, so that kind of employee experience is really important. And what I'd say there as well is that we went into COVID and remote working really quickly. What we're seeing is that wise organisations think really carefully about how they come back, and understanding that different people have got different needs. When we look at the profile of the workforce, what we're seeing is about 12 to 20% of people have needed to work in the office all the way through. And that's, by the way, this is outside essential services. About 20% of people are saying, I never want to come back to the office, thank you. And everybody else is in between. And what we're seeing again with resilient organisations is that they're really investing in understanding their people, and they're interested and curious. Sandy, you mentioned curiosity, it's so important, in how technology can smooth current pain points and ease transactions, and so that the employee experience is better than it ever has been. It's very enhanced, and also that it's deeply interested in cultural, the cultural quotient, understanding the diversity, the richness of their workforce, and understanding that there is a need for personalisation and individualisation. Our workforce of today want to be understood as individuals, and want to be connected with in a way that helps them to feel understood. And then the third one is the AQ, the agility quotient. What we see in organisations that are very agile is that they're experts at rapidly adjusting their strategic direction and offerings. They can flex and pivot in the way that we all have done and will continue to do as we go forward. They flex, they predict, they respond to new disruptions, they disrupt themselves. So many agile organisations actually deliberately have a disruptive stream, a disruptive team of people who are continually prodding the organisation and thinking of innovative and different ways in which they can do things better. And so that we think that this AQ is set to become one of the biggest predictors of future success in the post-pandemic world. And also what we're seeing in return to work post-pandemic return to work is that the psychological and organisational flexibility is absolutely critical in the way that we approach this. Thanks, next slide. What we're seeing here is that we're seeing a range of organisations, and this continuum, at one point, and one side we've got organisations who are returning to normal. So say, for example, some of you will have read the CEO of Goldman Sachs saying, working from home is an aberration. The CEO of Morgan Stanley Bank saying, if you can go to a restaurant, you can come back to work. And by the way, both of those organisations have got plans about how they return their workforce. But nevertheless, there's a group of organisations who are saying, we just want you back to normal as soon as possible. Everybody shifted their ways of working, but they are very clear. back into the workplace as soon as possible. And I know certainly at the EY, for a whole range of reasons, including we believe passionately in the vital role that the CBD plays for our economy and for our social environment and social fabric. And so we want to support the vibrancy of that going forward. But there's lots of different reasons there. Right at the other end, you've got Atlassian, who said, we just want to work, we're creating a world where we'll just have virtual teams and we want people to be able to work anywhere. We're going to bring people together around skills. Telstra, who are going to be, again, flexibility. Facebook, there's lots of organizations who've said, like, actually, we can be much more flexible going forward. And so we see a range of approaches that are fit for the business. What we see is these successful organizations in return to work have three principles that they've applied. They have a definite position and clear expectations, but they've also developed an approach to return to work that recognise the diverse perspectives of your workforce and their different needs. There's definitely been an increase in social anxiety around returning to work, and it'll have affected all of us in some way or form. Many of us have formed much stronger bonds with our family. We've been with our children, with our parents, with our pets, more closely than ever before for the last 18 months, and so it's a wrench to leave them behind. I certainly have got very, very comfortable with wearing a suit on the top and my leggings and trainers on the bottom and just going for a quick jog when I get a moment every day. So all of us have got things that keep us in the habits that we've formed over the past 18 months, and they can be hard to break. And there also are people who, say for example, what we've seen is an increase in agoraphobia and really deep anxiety about some elements of returning to work, whether that's travelling on busy public transport, or coming into crowded places. So wise organisations have got that high EQ and CQ in terms of a plan for return to work. But also what we're seeing as well is resilient organisations and organisations that are successful in this next phase also push their boundaries. They push the boundaries and encourage their workforce to push their own personal boundaries as well, bit by bit, small steps at a time, and leverage those opportunities that we've learned during COVID. Next slide. And what we've seen is that there are three key decisions we need to focus on as we think about the way that we're going to work and the way that we're going to stay resilient as organisations and as teams and as individuals during the months and years ahead. First of all, what type of workplace do we need? What type of culture do we need? And what type of people practices do we need? And what we've seen is all three of those have shifted over the last 18 months to 2 years as we've worked through COVID. So, for example, what we're seeing with our survey is that people are saying, I'm really happy to come back for collaboration and to come together to team and to work purposefully with others. And in fact, I'm really looking forward to that. But actually, if I'm just going to do individual work, I've actually found I'm really productive at home. So if I can continue to do that, that would be incredible. People's attitude towards learning has really changed, with people being very much more comfortable with any time, any place learning. So say, for example, so I now have got into the habit of doing my learning because I'm going for a walk with the dog at the weekend and listening to iPods and things like that, my iPod. And just here in this slide are some of the things that we're seeing that people are thinking about. And I noticed that there's a question in the chat from Wendy about organisations who are working regionally and small and mid-sized organisations. And yes, there are some differences. There's some real benefits. So we've seen that regional organisations in particular, regional and rural and remote organisations in particular, have actually benefited enormously, because we're seeing greater connectivity, we're seeing greater opportunities for workforce, members of the workforce who are physically located regionally and remote, because now people are not thinking, well, you know, we've got an office in Melbourne CBD, and we've got somebody who's working in Wodonga, Mildura, or wherever, Bairnsdale. Actually, that's not a problem anymore. We can actually have a diverse workforce, and we're also seeing that connectivity, meaning that businesses can create themselves. In terms of small businesses, what we're seeing is a mix there, because this to a certain extent, it's to what extent can you invest in technology, and what rate can you do that. But nevertheless, we are seeing that all sizes of business are being very nimble in their approach, and that connectivity is really a benefit that's been experienced during COVID, and it's something that we should hold on to dearly. So there's a question for you here, which is, how resilient is your organisation? You know, if you think of yourself against that that RQ matrix there of digital maturity, of CQ and EQ, so your connection to people, and also your ability to be flexible, your psychological and physical flexibility. How do you look? Are you prepared to navigate ongoing disruption? And we're seeing this kind of R factor as something that you can invest in and grow and develop much further, so that you can actually be more resilient. The great thing about this is resilience is not static. None of those features are static. You can grow these, you can invest in them, and you can get better at them. So finally, I think we will have some time for questions. It's great. So finally, one, let's acknowledge the challenges that lie ahead, but let's not be gloomy about them. Let's look at them as the opportunities that they provide, and find ways of maintaining a positive attitude and continuing that flexibility, innovation, and curiosity that we have developed in Oodles since over the last 18 months. Let's take baby steps when we need to. Now, we will take leaps forward, and so we should, if that's possible. But let's also be kind to ourselves and each other, and sometimes recognise that that as we return back into our workplace, we might reinvent our workplace in completely, but as we return to working practices, then let's take baby steps, be kind, but let's keep on moving forward. Let's stay resilient and innovative, and recognise this in each other and celebrate that. And also, my big message is, don't forget to practice self-kindness. Let's be kind to ourselves and kind to each other. And certainly one of the things that we have learned through the COVID experience is that we've all become more aware of our own wellness, both physical wellness and mental health, and we need to continue to invest in that and to help in that. And I'm going to finish off with a few tips from from Martin Seligman, who you'll know as a kind of champion of positive psychology and positive thinking. So, you know, let's actually stick with that picture. We'll finish with that picture, but you know, but practice gratitude daily. We know that there's always something to be grateful for, even if it's just a sunny day, the ability to walk outside with our mask on and have some fresh air, be deliberately generous to others in the way we think and experience other people and those around us, and also in finding ways of volunteering and helping. Let's choose our approach when we're moving forward, whether that's coming back into the workplace or whether it's thinking about how we work at home. Let's think carefully and deliberately about the way we go about this, and ultimately let's remain psychologically flexible and open, because that is the heart of resilience. So thank you. And now we've got time for questions. And yes.
We do, Sonia. We normally run out of time, so I know you've cracked a pace in getting through the presentation. Just to remind people, the presentation will be made available, so you'll get this presentation and the recording. So I'm just going to work my way through the questions, because you did go to some of them. So this is from Sue Seeley. Great to hear about all the innovations. Certainly a lot we can learn from. Do you have any data or thoughts re people working at home and the challenges of work-life balance?
Yes. So what absolutely one of the big challenges of working from home is the blurring of our professional and personal boundaries. What we've seen generally, and this is global, from our global database, what we're seeing generally is that the working day has extended. People are generally starting earlier and finishing later. When we're, particularly in periods of lockdown, we're seeing people working all round the clock. Weekends, evenings, etc. So those boundaries are harder. And also what we're seeing too is really very significant challenges when we're balancing homeschooling or caring for elderly parents and also working. And what we've also seen is an interesting gender shift with women in general, by the way, because most of our men now are amazing, wonderful and enlightened people who are really helpful colleagues around the home. But actually there has been a slip back to women picking up more of the home caring responsibilities as well as working. So there's been some shuffling there. It's been quite hard. And what we've also seen is a real a kind of instance of what we're calling cognitive overload, because the virtual working is incredibly, it's much harder to manage cognitively than face-to-face working, because what we're doing at the moment, and you're probably doing this now, is you'll be monitoring lots of faces. If I'm in a room with somebody and we were in a face-to-face conversation, I would look at each one of you individually. I would scan, but mostly I'd be attending on a one-on-one basis, and I certainly wouldn't be looking at myself all the time. And so what and then you've got, as I've got at the moment, I've got emails popping in the bottom of my screen, and
the dog,
and the dog, and blah blah blah. And so so we're overloaded. And what we're seeing as well is that people's capacity to continue to work virtually is really limited. The other thing we're seeing as well is an interesting thing with eyesight, is that people are spending too much time on short-term vision rather than long-term vision. So you must get out and look big every day, you know, look beyond the screen. So there are some challenges there. But we're also seeing some benefits. Just I'll finish then, because otherwise we won't have time for the questions.
So many more questions. Keep going.
I know. So I just want to finish with this, because what we've also seen, and one of the real benefits of working remotely, is that people with chronic health conditions, where they might normally take 2 or 3 days, maybe they might have, say for example, I'll give you an example, people with irritable bowel syndrome who may have to take time off quite regularly because they're unable to come into the workplace. What we've seen is that people with chronic health conditions, their attendance rate has absolutely maxed out during COVID. They've been able to work every day because the flexibility works much better for them.
Thank you, Sonia. Now, there's some great questions in the Q&A. We'll try and work through them. So from Jane, the pandemic has highlighted and exacerbated inequality. In the workplace, we see the impact on gig workers and casual and insecure workers, including casuals in aged care, really good example. From a social perspective, how do we ensure these new ways of work include everyone? And how do we ensure that the cost is not borne by those already that are disadvantaged?
Absolutely. I'm so glad you've asked that question, because what we're calling this is a K-shaped recovery, because the inequity is extraordinary. I think we've seen up front, and thank goodness we have seen the inequity. We've seen how our gig economy, casual ways of working actually force people to continue to work whether they're ill or whether they're healthy. And I think that's made us ask some hard questions of ourselves as employers, as policymakers, as legislators, to say, is this what we want? Is this what we need going forward? We're also seeing that there definitely is some people who have, you know, the economy, some people in the economy have done really well through COVID, and other people have done terribly, and that equity guide is set to increase unless we're very deliberate about doing something to close it. So we do need to think, and I think this is an ecosystem issue. It's something that we all have to step forward to try to address, and it's thinking about when we're in the businesses we run and the organisations we run, what is our policy on employment arrangements, and how do we make sure that we work deliberately to close those equity gaps, and we deliberately move away from creating them and reinforcing them. So it's a big society question, and many countries are facing into this as well.
Thank you, Sonia. I mean, I would like to note that in the recent budget, the Treasurer made sure many of the lapsing programs were funded. Now, yes, these are qualified people, but these are people that could have easily been unemployed. So I think there is a sense of the responsibility that government have as well about programs that are going to continue. So make sure we give some certainty to those workforces. David McGuinness, in relation to the agility quotient, you've got people very, very interested in these quotients. In relation to agility quotient, I wonder if our ability to predict change has diminished. Instead, maybe we anticipate change and respond accordingly. If and when it comes, will we see a trend towards more short-term plans and strategies that are less certain, less reliant on logical framework style assumptions and certainties, and maybe more focused on our capabilities to think and imagine the future? Beautiful, beautiful
That's
question.
a lovely question.
Yeah.
That's a really good question. I actually think it'll be a mixture of both. So I think we'll be able to move more. Well, I will call it nimbleness. I see that we can be more nimble in the way that we respond and move and quick, and we will see opportunities. What's really interesting is when we look at the really disruptive, like big disruptions, then usually they come in what's called a hockey stick shape, because actually they start way back, but we just don't see them. And then the moment for them to be valuable and useful and go to scale comes quickly because we seize the opportunity. So interestingly, there's been a big shift as well in our approach to strategic planning. So, you know, like I was brought up in an era where we would have always had our 3 to 4 year strategic plan. You know, that's the kind of frame we set in. Now, what we're seeing in this world of exponential disruption is that really resilient organisations actually have a much longer term plan, a 14 to 15 to 20 year plan. That's a long stick of the hockey stick, and a rapid, nimble 3 month, 6 month, 12-month plan, our year ahead, which allows them to respond really quickly and swiftly as required. So it's that blend of very long term and really, really in the here and now, so that we can be opportunistic.
Love the hockey stick. I love a visual. We're going to go to Lisa's question now, which is a great question. What can we do in the human services sector to prepare for the impact of the lag effect of COVID on children and families who experience vulnerability? Does the flexibility quotient mean that we reimagine even more how we deliver services?
Oh, yes. And there's some great examples here in Victoria of the way that people have, in the human services sector, have really reinvented and are really thinking through the way they deliver services, and particularly for children and young people, and thinking about using, you know, technology, phones and social media, and actually the environment that young people thrive in, to be able to connect in different ways. Now, that doesn't take away face-to-face, by the way, because there's still a really strong place for that, but also thinking about how we use community. I mentioned earlier about some of the examples from around volunteering, is like the opportunity to think about how young people can connect together, and services and young people can connect together locally in their local community, in their neighbourhood. So definitely, and I actually think, and I don't know, I can't see who's in them, but if Sandy and I think I saw Agiri earlier, why don't we have a texpose, a human services texpose, where we actually or innovation expose? You've probably, by the way, already planned this, but where we could really share the kind of lessons learned and the ideas the kind of practices that have emerged, that are working, that we found have worked, and just continually push ourselves to innovate going forward.
Fantastic. This is I love a sciencey question. So Nikki says, Sonia, are there any suggested ways that organisations track, identify gaps in and improve their R quotient? I told you, people love these quotients.
Well, we've just come up with the RQ, but all of those three components are trackable, and so certainly some of the work we're doing with organisations is helping them to do that. So already there's a maturity framework for digital maturity. So there's you can actually measure and assess your digital maturity. You definitely can with your EQ, CQ. We've got a cultural a culture dashboard that we use, and also workforce wellbeing tools that are around. Workforce wellbeing surveys that help you to really just tap in and pulse check on the health and wellbeing and positivity and flexibility of your workforce. And AQ is, and in the slide you'll see the lab that have developed the AQ notion, which I love. It's a guy called, an amazing guy who I'm regularly in communication with, called Amin Tufani, who has developed the AQ. And again, there's an assessment tool at individual and local level. So yeah, so RQ is coming next.
I'm just going to go to a couple more questions, and I'm going to see if Sandy wants to make some comments, because there's been so much that has come up that I'd really like her to just sort of reflect on. But I want to go to Sam Biondo, our partner in Tripeak. It's really, really appropriate to go to Sam. Now, look, Sam and I are both people. And he and I will, he's asked the question about, does this new environment make him redundant in the new world? But his second sort of point to the question is, the transitions in work before us are truly grand and in many ways daunting, which is really what we're talking about today. The move away from the physical presence in a workplace to the virtual and hybrid world will bring an evolving wave of issues. One of the ones that is focusing his attention relates to health and wellbeing issues for staff when distant from the centre. When you say invest in this, I still feel distance from human interactions makes me working in human services very difficult. Any ideas of what might make it a bit easier?
Yeah, I think, and this goes back to my connectivity theme, we have to work much harder, and that's the EQ, CQ. Yeah. We've got to work much harder at the ways that we connect. We've got to be really deliberate about it. And if I look just at EY and the way we've changed our practice over the last 18 months, so, you know, we've created small family groups. So every single member of our workforce is in a small family group with a partner. And we have a weekly, during the most significant periods of COVID, we've had a daily check-in. We're now at weekly check-ins. We keep on trying to get together and have a big party, but like we always pick the wrong date. But it doesn't matter actually, because we do virtual stuff. But we have, and also the other thing as well, and this is why the real connectivity with workforce matters, and some of the tools, going back to the question, like the cultural tracker and the wellbeing trackers are really important, because the other thing online is it's really easy to miss somebody struggling. Because, you know, when you're in the office, if you can see and sense if somebody's a little bit down or a little bit unsettled, etc., it's very easy to misread the signs. There are signs, so, you know, people off screen, people changing habits, people who contributing less, being quieter, etc. So there are things to do, and the back end of our technology, so Teams in particular, is phenomenal at being able to, and will give you personal messages that will say, you know, you've done X more or X less, but you can, there's ways of doing it, but we have to be much more deliberate, and we have to make it a part of our ways of working. And again, what we're seeing is the most resilient organisations are those that are investing in the health and well-being and connectivity of their workers, and really investing there.
There's some great comments in the Q&A, the chat, but I'm going to go to Sandy now, and if we get chance, I will read some of those out towards the end. I think your comments about chronic conditions and people still being able to work. I mean, there's a fantastic comment in the chat from one of our colleagues about being able to continue to work. So you've hit the nail on the head there, Sonia. Over to you, Sandy, if you'd like to make a few comments.
Oh, thanks, Deb. And I feel like I'm jumping into a place where the comments in the chat are a degree of magnitude of better comments than I will make, a degree of a higher level. But because some of the things I've been reflecting on, Sonia, and just fantastic presentation. So thank you on behalf of everyone. I can really see the enthusiasm for what you've been sharing. I think there's something great for us as people who in organisations working in our workplaces to think about. So I feel like you could urge us to, think of the 3 takeaways from your presentation, and I know we all would, and many of them wouldn't be the same because you've shared just so many. I think there's also, and I would say, let's all think about some of the personal takeaways as well. We're all individuals who live in families and communities as well as being workers. And I think as you talked about, the personal and the work has merged in ways that perhaps hasn't before in the pandemic across so many of us. And I was thinking, as you were talking about how much easier I suspect it is, this is nothing like an anecdote feeling, to be a resilient person if you're in a resilient organisation, and how much harder it might be to work on personal resilience if all of those organisational structures around you, or indeed the work you're doing, is not in experiencing those resilient quotients. And so therefore it's almost like the first aid kit. It's stock yourself up, look after yourself, then look after the others around you, and then build out from there. And I think there's something pretty powerful in that, in what you've shared today. The thing I'm really going to take away, and it's just been great to have it sort of captured here, is if anything, we are in the middle of a pandemic, and so that part of being positive has been hard, and in fact I would suggest even perhaps guilty sometimes if we're looking for positive when we know there's been so much suffering and so much that's gone wrong. But what you've really urged us to do today is not be so binary, but think about the positives amongst a negative, or indeed the negatives amongst those positives, and how to emphasize them and make the most of them. And I think that's really important personally, and particularly important professionally. So I'll certainly be taking that away, Sonia, and I'm really grateful to Deb and everyone in the Tripeaks for, I think, keeping that theme alive all of last year and this year, which is ongoing learning, ongoing connection, not stopping the important work, but also being caring and kind as we go through it. So a big shout out to all of you for living that. And Sonia, thank you so much for bringing the lens that you've brought to this conversation today.
Thank you, Sandy. There are lots more comments coming through and questions. We are at an hour. What we're going to do with those, though, is take them away, and we'll write them up. But also, there are questions and comments there that Sonia will want us to sort of respond to you offline. So don't worry, you'll get a response from us. You'll also get the slides and the recording. I just want to say thank you to Sonia and Sandy for being here today. The comments in the chat are, this has changed my way of thinking. This is fantastic. This is awesome. This gives me something to take away, a framework to think about and to apply. Because to be honest, we do need to keep rethinking and re-engineering the way we are going to get through this. Because I was actually at a meeting with a great departmental colleague the other day where it felt like people were thinking it was over. This was just before this lockdown, and he and I agreed we needed this session, and that's when I went to Sonia. So every time we think we might be in a place where we probably need to keep moving forward, it's important to have these sorts of conversations. Thank you so much, Sonia. Thank you so much, Sandy. Thank you to my team, Oliver and Daniel, for doing all the stuff in the background, but also Nadia and Ishwa, who work with Sonia and put all this fantastic information together. And look after yourselves and take care of yourselves out there, and I'm sure we'll be back together again soon.